Are you the only person in your practice that has this technology at this point, or
Currently,
how are you feeling? How do you feel about the rest of the team? Because you work in a bigger practice.
welcome back, peeps. Hello. Fancy seeing you here. If you're watching this on YouTube, hello in real life. It's been a minute, and I want to say thank you for all of you that have been patiently awaiting the scheduled release of some of these episodes. And if you didn't notice, then let's pretend I never said that. I hope you're having a great day. I am recording this intro from my living room. As you can see, the foliage of the garden in my living room, which is great, keeps me very busy. Plants bring me joy. I think there's one thing that I want to say about this week's episode is that the important thing in everyday life is that we do something every day that brings me joy. And recording podcast episodes bring me joy. I've learned that in the last little bit. I've got to connect with some really cool people, and you'll be excited, I think, about some of the content that's going to be coming out every Tuesday moving forward. So thank you for tuning in again to the Tooth or Dare podcast. This episode was recorded live on the show floor at Yankee, sponsored by my friends at Designs for Vision, who I'm sure you've seen lots of content on my Instagram come out, sponsored by them. It's just a remarkable company, one that I've enjoyed really working with over the last few years now. It's been a few years. And seeing the development and changes of the products that they've created with dental people in mind, and that collaborative response between dental people and now medicine as well, which is what this entire episode is about. It's a very short episode. It's like 15 minutes, recorded with Katrina, whom some of you may remember as my past co-host on the show, aka the dental wine hygienist. And you'll hear some messaging from Robert, who is one of their internal peeps at Designs for Vision, that is going to share a lot of information about Reveal, a technology that I have yet to use and that I'm very excited for. And it's this bridge between medicine and dentistry, and specifically with bacteria. This series of loops and fluorescence and technology helps us visualize bacteria in the mouth, and by looking at porphyrins, which is something that you'll learn all about it in this episode. I don't want to give it all away, but it's really interesting, and I think that it's revolutionary in dentistry, and it's something that really speaks to my core values, which my team at my office have been looking at creating or redesigning over the last month, for the reason that, for anyone that's listening that's, watched my Instagram stuff, that like we do things a little differently. We don't quote unquote just scale teeth, and unfortunately, we have turned some patients away because of what their expectations have been very, very different than the reality of what we want to provide. We want to provide excellent care, and excellent care sometimes comes with more steps than what we learned in dental hygiene school, or what I learned in dental hygiene school like 16 years ago. Oh my God, it's like dating me to say how old I am. But that comes with change, and changing what you do in your everyday practice is probably going to determine what happens with your cases in the future. So I think this is a beautiful example of what change can look like, and a beautiful example of how difficult it may be for some people, coworkers or patients, to understand that we're doing things differently. And Katrina said it really nicely, because she talked about how she works in a practice that she's the only one that uses this technology when she practices, and nobody else does. And, what's that conversation like between you and patient, and you and fellow team members? And it's okay to be different. I think that's the molar of the story in this intro, is that it's okay to do things differently, and it's okay to be different than the other people that you work with. But the goal is that you're providing the best care that you can. And sometimes that opens you up to a little more scrutiny. Sometimes that might open you up to taking more time, that ever crazy billable time that we're always fighting and struggling with. But the molar of the story is that it's okay. And if you go to your office on Monday morning, or whenever today, now, 5 minutes from now, and you go there and you look at things a little bit more critically and say, is this the best option for my patient? Is this like the best treatment that I could provide? And if your answer is there's something else out there that I should be incorporating, then like I strongly challenge you to like go for it and try and implement it in your practice, into your everyday life. Perhaps that just means, adding one more step to your assessment, adding one more step to that oral cancer screening, adding a device if you can, and like advocating as hard as you can to the employer, whoever's doing the ordering in your office, and don't back down. Because Irene of 16 years ago when I first graduated until the moment that I decided to open my own practice, and that was an excursion of 13 years, I backed down sometimes. Like I really did. I backed down because so many times you hear the word no and then it becomes your reality. And it was until the moment that I was like, I can't keep hearing the word no because it's impacting my patients. That's when I decided to just risk it all, risk everything to do what I thought was best. So here's the episode about maybe something you might consider in the next few to 5 years. I say few to 5 because I hope that maybe it's more soon than that. But thank you to my friends at Designs for Vision for sponsoring and inviting me to your trade show and setting up a little table in the booth at the bottom of the stairwell in Boston. Yankee's a great conference. It's held in Boston in January every year. Don't worry about the weather, but if you ever get a chance to go, I strongly encourage it. So check this episode out. Episode? Yeah, episode. It's a YouTube video, but it's an episode. Is the podcast a YouTube channel or is the YouTube channel a podcast? I don't know. Either way, it's happening. So thank you. And until next time, peace out, peeps.
Welcome back, peeps. Katrina and I are sitting at the bottom of the escalator at Yankee. And if you know anything about Yankee, the bottom of the escalator is where everyone enters and exits from.
Irene, I think we should do a description of what it is that we're in right now. Like there's
a video. So all of the people that are watching this on YouTube, and if you're not watching it on YouTube, you should be watching it on YouTube.
You should, yeah, get on YouTube.
Yeah, because you can actually see our mugs now. It took me getting rid of Katrina to actually start recording video.
You're like, well, now that Katrina's gone, I can show my face.
No.
Everybody always said I have a face for podcasting, so thank you, Irene.
We were always in like different places. Do you remember when we recorded that episode and I was actually doing my makeup?
No, I remember the time that we recorded and you were in a robe.
And I looked like an avatar.
You had just gotten out of the bathtub is what had happened.
Yeah, and you were getting ready for dinner, so... Anyways, new year, new me. We're recording an episode at the Designs for Vision booth.
Yes.
It's going to be a quick episode because you and I have actually not talked about reveal. And we're going to reveal. And there's a new reveal coming. So for those of you that don't know what reveal is, and yes, this is a sponsored episode, but yes, I would also be talking about it if it wasn't a sponsored episode because it's pretty freaking cool.
It's like the newest thing that's happening in dentistry.
If someone were to explain it to a sixth grader, it's basically like magical glasses that shines a different color light of a spectrum, just like the same spectrum that I'm on. And then it shows the color of the plaque bacteria porphyrins that emits this magical glow.
They emit a fluorescence, yes.
Fluorescence.
A magical glow of sorts.
That can identify lesions, like pathology, like
carious lesions.
I know nothing.
Okay.
Like, I am whiteboard. You are about to like flow chart me right
now. Check out the exits at the front of the plane, side of the plane, and the back of the plane.
And Katrina, you were here yesterday and you did a thing where you shared some knowledge with the peeps here.
Yes.
And now you're going to do the same like 15-minute spiel.
Let's spiel it.
Spiel it for me.
I'm going to spiel it for you.
And I just saw your sister.
So, yeah, she's here.
She's here. But keep going. We're going to ignore her.
We're going to ignore her.
Yes.
Actually, it's kind of funny that you mentioned my sister because this is really where the crux of the reveal technology began, was in medicine, and particularly in wound care. See,
the crux of this technology?
Crux of the technology.
Take me back.
I'm just going to dial it back. When we manage wound care in oral health and when we manage wound care in other areas, part of the challenge is we needed to better understand how we were going to be able to approximate the wound, how we were going to manage the wound, and ultimately support our patient's immune system.
Okay.
So my sister's a foot and ankle surgeon, and she sees patients who are like end-stage diabetics.
Right.
And she's managing these diabetic foot ulcers, right? Neuropathies, all of that, right? Within this, think about a diabetic patient. They're already immunocompromised. So we say all the time they have delayed wound healing, right?
Yes.
So what do we do when we treat a patient in dentistry? We just scrape everything. We are oftentimes removing otherwise healthy tissue, but we're just blowing everything out.
The fancy peeps call that root planing.
We do.
And curettage.
And curettage. And the thing is, when we curettage out the healthy tissue along with the diseased tissue, now the body has to go back to how are we actually going to repair this wound?
Right.
And for somebody who is a delayed wound patient, which we see often, the issue really becomes, are we doing more harm than good by removing all of the tissue instead of just specifically targeting the granulated tissue that needs to be removed? Well, the same was true in wound care. So we're talking about diabetic foot ulcers or individuals who have wounds associated with chronic disease.
Right.
At any rate, they started to recognize that bacteria release a fluorescence, that if we can
Is it all bacteria or specific bacteria?
specific disease-producing bacteria. And when we take a look at how this bacteria behaves, if we can use a very specific fluorescence on this bacteria or on infected tissue, that we will see a fluorescence or a glow if it is infectious or if it needs to be debrided. And it will not glow if it is not infectious or if we're looking at appropriate bodily tissue.
So say that you've got, a variety of areas that have plaque bacteria, calculus. You're telling me that you can have areas of plaque and it won't fluoresce at all?
No, so what we're saying is that the biofilm itself releases this. Yes, so how this has been applied in medicine is really where it began. Neurosurgeons would utilize this technology. They would open up, somebody's brain cavity and they would look at an individual who has a tumor.
Yeah.
And you could actually see, you could approximate the entirety of the tumor and the edges, the borders of the tumor. How important is that in medicine,
Which
right?
you peeps are probably looking at right now because we've edited a video of that in.
Oh, yeah. So as we're looking at that, you can see, likely in the video, the fluorescence and the edges of the tumor itself. And the beautiful part about this is now it allows the neurosurgeon to be able to specifically target and not remove just an unnecessary amount of brain tissue. How important is that?
Yeah.
So let's talk about how we apply that in dentistry, shall we? You had mentioned that, we call it scaling and root planing. But the important thing is we now know that we shouldn't actually be root planing because root planing. Should we say that one more time? Because root planing actually intentionally removes tooth structure.
Right.
And we know now that we shouldn't be removing that cementum because when you root plane an area, you're removing that cementum that our attachment apparatus needs for healing.
You're creating too much of a smooth surface.
Correct. Now, did you go to hygiene school when
root planing was a thing?
Yeah, and your instructors would check to make sure that the root surface was glass smooth, right?
Yes.
Just like this ice skating rink over here.
I know.
Right?
Yeah.
So you had to be glass
I had to
smooth.
really flip my brain around because we were taught to scale every area. You do it in a sequence. You start from the right, you go to the left, you scale to completion.
That's right.
And now, and I mean not just now, but for the last perhaps decade, it's selective scaling, localized scaling. You are more detecting than you are scaling on, prophy patients and that sort of thing.
That's right. That's right.
Absolutely.
So I think the important piece to all of this really becomes, now that we've changed this paradigm or this protocol, how does that actually show up inside of our instrumentation?
Right.
Because you and I were probably taught to take an 11-12 Explorer, run it along that root surface, and make sure it felt glass smooth.
Yeah.
So how do we change that now? Technically, rough cementum should be left alone. So now we have to look at our tactile sensation, our psychomotor skills, and really address this in a different way. So the neat thing about this Reveal technology, the use of this fluorescence allows us to turn on this fluorescent light, be able to stare at that root surface, and if it doesn't glow a hot orange,
you leave it alone.
You leave it alone.
So how does that work with air polishing, let's say, or using erythritol? GBT is a huge thing now. Obviously, you're not going to leave everything alone.
You're not going to leave everything alone, but you're going to be very specific and targeted. It's this new concept called precision medicine that we're trying to integrate into dentistry, which means, Were you taught selective polishing?
Yeah.
Of course, right?
Right.
Now, what do we do in the real world? Most hygienists will just take every
Right.
single tooth, right?
Yeah.
But the idea behind selective polishing was we didn't want to damage. We know the
Healthy acquired pellicle.
That's right. We just wanted to allow it to be preserved. That we shouldn't just be bulldozing in
Right.
and destroying everything, but we should be
Right.
precise and targeted.
Right.
And so through the use of this fluorescence-guided technology,
Yeah.
we're able to be very specific and targeted. Now,
Yeah.
that's just us talking about perio, but
Sure.
the reveal technology itself allows us to be able to see debridement areas around dental implants, for example.
Yeah. You shared some really cool videos with me that if I have your permission, I'll load them up here and you can share them along. But what you'll see is just that you're using this during your entire appointment. Like I didn't see you really flick the light on and off very much. You just kept it on.
Yep.
Whereas in the brain surgery video from earlier, like they would identify, then they would go remove, turn the light back on. What does that system look like? Is it like connected to your loops or? Do you need special glasses? You have to turn the lights off? What's the patient side of it?
And we're still kind of developing in dentistry how to do that because to your point, in a surgery suite, you've got a zillion different nurses there and surgical techs and things like that. And usually we're working relatively isolated as hygienists. So the way that we've integrated it within our practice currently is I have the system on. It's an entire system with, a protection over the loop itself, and then the light. The light flips on. I know Designs for Vision is really working to help support being able to flip-flop back and forth between our LED light and fluorescence-guided light right now. But you flip it on. I keep it on for the entirety of the care because it allows me to see not only areas that have calculus, but areas where there is granulated tissue in there.
Sure.
So now I'm able to help guide the doctor in areas where we need to target that laser. So we keep it on throughout the entirety of the procedure, and to me the coolest part of this is explaining to the patient why I'm wearing a new set of loops and a new light.
And is it a whole set of new loops, or is it adapted to exist? Like, can it be adapted to your existing pair of loops if you already have Designs for Vision loops? I mean, I know you're not a saleshuman. Maybe I can ask that question after, but so it's just one big unit all attached together.
Mine is one big unit. Yeah, I like it that way. I think that allows for me to know exactly what pair of loops I'm going to be wearing to target my patients in surgery versus, I'm going to be wearing a different pair of loops. This is how I approach care when I'm doing consultations with my patient. But it goes back to the age-old concept. Picture is worth 1,000 words. And how often do we take these bloody gum tissue photos and we try to show the patient these are the areas where you're bleeding? And most patients will say, well, yeah, it's because you stabbed me in the mouth.
Right.
That's why I'm bleeding.
Yeah.
Now we're able to use this technology, flip it on, and show the patient these are the areas where there's inflammation in your mouth. It's like a heat map of inflammation and a heat map of disclosing where the debris is for our patients.
Very cool.
Which has absolutely transformed the way that we provide perio care to our patients. So it's been phenomenal, and we're very interested, of course, long term in what this means because we're not destroying everything for our patient. We're being more precise and targeted. But the best part about this for me is that I spend less time in perio surgery.
Do you actually?
Yeah, because now I'm not just scraping on everything.
Right.
I'm being very targeted. This is the area I need to focus on. This area, I look straight down into that pocket. It looks...
So let's say you were doing an SRP before. Are we still calling it an SRP?
Yeah, it's still called SRP because that's
what the world is calling it. Okay, so we're doing this SRP adjacent in a quad. So in the United States, it's per quad.
That's right.
In Canada, it's per time.
Yeah.
Like 15 minutes of SRP. How much time does that now take you per quadrant? I mean, every severity is going to be a little bit different, but okay, so let's say how much time are you kind of shaving off?
At least 30%.
Wow.
At least. Which really was eye-opening to me because it made me realize that there's a large portion of what it is that I've been doing that was not only unnecessary, but also could be damaging. Do you know what I'm saying? Like, what was I doing to destroy this? And
This like overscaling kind
Yes.
of. Yeah.
And that torn cementum, we now know, like, it's so hard for the body to heal there. So again, think about your delayed wound healing patients. They're already delayed because they're diabetic or rheumatoid arthritis or immunocompromised, whatever that may
Sure.
be. So they're already delayed, and now we're making it even harder for that body to heal.
Yeah.
The core value of do no harm really comes into play here. So we now know. And according to Dr. Maya Angelou, it's always do the best you can until you know better. Then when
Yeah.
you know better, do better.
Interesting.
So we've integrated this technology as a means of
Yeah.
doing better.
Are you the only person in your practice that has this technology at this point, or how do you feel about the rest of the team? Because you work in a bigger practice, so like.
Yeah. So I brought it
Yeah.
to AZ Perio, and they started to kind of circulate around
Right.
and start using it, and the hygienists were so excited. So now the conversation is,
How do we get it?
we're
in?
getting it. That's right. Yep.
Yeah.
How do we get it? Get one for every doctor and every surgical hygienist at
Yeah.
this point. So it's one of those technologies that if one clinician in the practice has it, it elevates that standard
Yeah.
to the next level, and it's something that allows us to be able to calibrate and live together.
Yeah. I watched the video, I believe it's shared on YouTube, so I'll share the link below, with Dr. Liviu, I can't remember his last name.
Livu, yeah.
Something.
He is
He's a Romanian dude. So one of my peeps. And he shared some before and after photos with, I don't even know what's the fancy word for it, the light's turned on kind of thing.
Yeah.
Yeah.
Mhm.
With caries as well, with early carious lesions, and like being able to identify early carious lesions on direct surfaces as
That's
opposed
right.
to interproximal surfaces, so buccal, lingual, occlusal, and identifying it early, like super, super early,
Yes.
which has its benefits as well for a
Yes.
hygienist before the doc comes in for that exam. I mean, we're doing that with disclosing agent, like
Yes.
where anything that's lighting up purple, we're taking a photo of it, and then when we remove the biofilm, we take a photo of it again, see if that white spot lesion is either shiny or if it's glossy. But this just like elevates that one extra level.
Yes.
And to have the capabilities to be able to take an intraoral photo, which I know that they're working on integrating the system with their camera,
Yeah.
to be able to take those photos chairside and upload them to the patient file. That's really cool.
Yes.
Yeah.
Yeah.
Interesting. Well, as my friend Katrina says, stay tuned
Stay tuned.
for more info. I'm hoping to get my hands on one soon. So let's see. I know they're working on a 2.0 version, so that's what I'm waiting for.
Yep.
And thank you for sharing this info with
Oh my
us.
gosh! Thank you for having me
It's
here
like
today.
always welcome on this podcast.
Oh my gosh!
Like permanent position.
I love it. Great.
Cool. All right, peeps. Thanks again for tuning in to another episode of the Two Thirds Air podcast. And until next time, peace out, peeps. You can do it.
And I'll catch you on the flippity flip.
You didn't say cheers.
Cheers.
She's been gone for like, what, 3 weeks? And she's already forgotten.
Irene.
Bye, everyone.